This short movie is directed to any person who is going to join the KRG Health Information System, introducing the context and the operating environment where the system is running, the purposes and functions already available. In 2015, Italy, and the government of the Autonomous Region of Kurdistan, started a collaboration to create an epidemiological surveillance system in the region. Since then, the project, which underwent a pilot phase in 2016 and 2017, entered the operative phase in 2018, and today we gain the first harvest of work already done, thanks to the collaboration between Italy and the Ministry of Health of the Autonomous Region. The Italian experts and technicians, epidemiologists, IT engineers, statisticians, collaborated with the health staff of the region, clinicians, nurses and personnel of the statistic departments, and with the managers of the ministry and of the health directorates, in order to deploy the health information system, in the health centers. The Ministry of Health, of the Autonomous Region of Kurdistan, ensured to the project the collaboration of its personnel, and made available the local IT infrastructure, specifically internet connection and computers in each center. The Iraqi Kurdistan citizens are used to access the primary health centers, PHCs, and the family medicine centers, FMCs, for the majority of their health issues. The centers provides also the basic health education. The health services are on free and universal basis. This is a valuable heritage of the Public Welfare Administration. It ensures the possibility to monitor the health conditions of the population, and to transfer top-down the sanitary measures.
The main primary health centers are staffed by doctors, pharmacists, nurses, and further support staff, while the smaller centers, located in rural areas, are staffed by non-physician providers. The PHCs provide diagnosis and treatment of common illnesses, and of dental problems, maternal and child health care, vaccination, growth monitoring, antenatal care, health education, provision of necessary medicines. The hospitals are classified as general, maternity and pediatric, or specialization hospitals, and are defined as teaching hospitals if integrated in a university college of medicine.
Before the introduction of any health information system, the medical records of the citizens are collected in huge storage rooms in the FMCs and PHCs, usually ordered by family name, and in clinical records warehouses in the hospitals. To pick data for epidemiological purposes from these records, it's an hard data mining job. Also, to find records for certifications purposes is time-consuming. Some hospitals have an electronic data recording system, but it is different from hospital to hospital, and it makes difficult to gather data together to deliver statistics. The training sessions in the centers have involved the medical doctors, other health staff, and the statistic department staff. After the first sessions held in each province, through plenary meetings with presentations and frontal lessons, the center's opening sessions are always held in the unit's facilities, because it is important that people do their job using their hardware and the connectivity available in their site and offices. The project, in this way, is also boosting the IT infrastructure upgrading of the units.
The main goal of the HIS system is to make available for the KRG medical doctors, and for the managers of the health system, at the ministry level, in the health directorates, and in the health centers, the data about the diseases diagnosed, the diseases details from the hospital's discharges reports, the mother's and child conditions at birth, the death causes, not only as crude data, but also framed in statistical tables and graphs, giving opportunity to deliver reports on the past, and forecasts for the future, making possible to knowingly adopt any policy.
The KRG Health Information System has been deployed to more than 60 health centers and hospitals in Kurdistan region, as units of the surveillance system. It has 4 main programs of data collecting, diseases surveillance, hospital discharge, births registration, deaths registration. Each unit has at least 2 people trained in recording and checking data, but in the majority of the units the people trained are more. The training is delivered by Italian specialists with the assistance of the Kurdistan staff, collaborators of the project, and students following Italian doctorate programs focused on the project. The system not only collects data, but delivers statistics and tables for analyzing the data, and for giving a picture of the regional health status. The system is interoperating with the databases already present in the units, when available, and month after month enters deeply in the articulated, complex, and diversified network of the health regional organization. The increasing of the staff of the units involved in the system, and the continuous training, delivered also at distance, by the project staff is generating a wide community of users, with different skills and responsibilities. The system gives the possibility to access the statistics for the whole region, but also the descriptive data for a single unit, and the monthly or weekly or quarterly reporting about the health topics the system deals with, the diagnosed diseases, the births conditions, and the causes of death. Each directorate may design its own reporting tables, and the same may be done for a single unit. The project staff in Kurdistan gives the possibility to discuss the local instances also in Kurdish or Arabic language. The system has 3 languages: menus and functions and data presentations, Kurdish, Arabic and English. The valuable result that the project is gaining is the spreading of the knowledge about the relevance of data collection, the habit for the continuous training about an evolving platform that follows the mutation of the health system in presence of emerging needs that are conditioning, and are influenced by, any detail of the material organization of the health centers and of the hospitals. In each unit where the system has begun to be adopted, a group of 2 or more persons involved in the health management is now dealing with the data collection, analysis, and with the meaning of the statistic tables from the clinical data. The project is offering the occasion to have people trained and upgraded in the context of their activity. The Kurdish doctorate students are the reference people for all this community.